Welcome to our deep dive into the world of AI in surgery. We've got some fascinating research to unpack here. Really looking forward to exploring if this is just hype or if there's real hope for the future of surgery.
It's a great question, and it's one that deserves careful consideration. There's definitely a lot of buzz around AI in healthcare, that's for sure, but we need to separate the hype from the real, genuine advancements.
Yeah, totally agree. So let's maybe start by unpacking the history of robots in the OR. I know the Vinci Surgical System is a big name, but where did it all begin?
Well, the first robot to actually enter the operating room, you might be surprised to hear, it was the Pume 560. Back in 1985, it was used for performing biopsies under CT guidance, a far cry from the complex procedures that we see robots assisting with today.
Wow, 1985. That seems like such a long time ago considering how quickly technology advances.
It really does, doesn't it? But it wasn't until the 1990s that things really started to take off, with the development of the Vinci Surgical System, which received approval for use in 2000.
Ah, the Da Vinci system, I think that's the one that I've heard of. What made it such a game changer?
The Da Vinci system really revolutionized minimally invasive surgery. It allowed surgeons to perform complex procedures with smaller incisions, less trauma to the patient, and potentially faster recovery times.
So it wasn't just about having a robot in the OR, it was about making surgery less invasive
Yeah.
and more patient-friendly.
Exactly. And around the same time, there was another robotic system called ZEUS, and it was making headlines with a pretty mind-blowing procedure known as the Lindbergh operation back in 2001.
The Lindbergh operation. What was so special about it?
Well, it was the first ever transatlantic surgery. A surgeon in New York remotely controlled the ZEUS robot to operate on a patient in France.
Wow, that's incredible. It really highlights how technology can revolutionize access to healthcare. Were there any other robotic systems developed around that time?
Yeah, the field continued to evolve with newer systems like Versius and Synhance, each offering their own unique features and capabilities, really demonstrated that ongoing drive to refine and improve robotic surgical technology.
So while robotic surgery was taking these leaps forward, AI was making its own strides in the world of medicine, right? When did AI first start to make its mark?
Well, AI's early forays into medicine can be traced back to the 1970s and 80s, with systems like YCN. It was a program designed to diagnose bacterial infections and recommend antibiotics.
It's amazing to think that AI was already being used in healthcare way back then. Was it successful?
You know, OCN actually performed quite well in tests, demonstrating an accuracy comparable to experienced clinicians. However, it wasn't widely adopted due to various practical limitations and some resistance from the medical community at the time.
It's interesting to see how the acceptance of AI in healthcare has really evolved over time. Were there other early attempts at using AI for medical purposes?
Yeah, in the 1980s, systems like Internist One and Caduceus emerged, trying to mimic doctors' diagnostic reasoning. By analyzing patient symptoms and medical knowledge, these systems were ambitious, but proved to be incredibly complex to develop and implement.
I can imagine. It seems like replicating those intricate processes of human diagnosis. It would be a monumental task for AI.
It certainly was, but you know, those early efforts really laid the groundwork for future advancements. By the 1990s, AI began to find its footing in medical imaging, with systems like computer-aided detection, or CAD, being used to assist radiologists in spotting abnormalities in mammograms. This marked a significant step towards the integration of AI into clinical practice.
So how did this convergence of robotics and AI lead to these AI-powered surgical tools that we see today? What are some of the key components that make AI surgery possible?
Well, one of the most crucial elements is computer vision, which allows robots to see and interpret images from surgical cameras in real time. This is essential for identifying critical tissues, blood vessels, and anatomical structures, enabling surgeons to operate with greater precision and safety.
It's like giving the robot an extra set of highly sensitive eyes. What other tools are in AI's surgical toolkit?
Another powerful tool is reinforcement learning, where robots essentially learn by trial and error. Through feedback mechanisms, they refine their techniques over time, improving their precision and efficiency in performing specific tasks.
So can you explain a bit more about how this feedback mechanism works? What kind of data is used to train these AI systems?
So imagine you're teaching a robot to suture, In reinforcement learning, the robot would attempt the task repeatedly, receiving feedback on its performance after each attempt. This feedback could come from various sources, like sensors that monitor the tension and placement of the sutures, or even from a human surgeon who evaluates the robot's work. Over time, the AI system learns to adjust its movements based on the feedback, gradually improving its suturing skills, until it reaches a desired level of proficiency. This type of learning is particularly valuable for mastering repetitive or delicate tasks that require a high degree of precision.
That's incredible. So it's not just about pre-programming the robot. It's about allowing it to learn and adapt through experience, much like a human surgeon would. What about understanding medical language and patient information? Can AI handle that too?
Well, that's where natural language processing comes in, or NLP. NLP allows AI systems to understand and process human language, specifically medical terminology and patient records.
So an AI system could potentially analyze a patient's medical history and alert the surgeon to potential risks or considerations during surgery.
Exactly. Imagine an AI system that can process a patient's medical records, identify relevant information like allergies or previous surgeries, and flag any potential concerns for the surgeon in real time during the procedure.
That would be an invaluable tool for ensuring patient safety and minimizing the risk of complications. It's almost like having a highly knowledgeable assistant in the OR who can access and process vast amounts of information in an instant.
That's a great analogy. Now, let's shift our focus to how machine learning is being utilized in various stages of surgery, from pre-op planning to post-op care.
All right, let's delve into the practical applications of machine learning in surgery. How is AI being used to enhance the entire surgical journey for patients?
Well, before the surgery even begins, AI can play a crucial role in pre-op planning by analyzing vast amounts of patient data, including medical history, imaging results, lab tests, and even genetic information. AI algorithms can identify potential risks and help surgeons create personalized surgical plans.
So AI is being used to assess the patient's individual needs and tailor the surgical approach accordingly. It seems like this level of personalization could really significantly improve patient outcomes.
Absolutely. AI algorithms can analyze data to predict the likelihood of certain complications, like excessive bleeding or infection, allowing surgeons to take proactive steps to mitigate those risks. This level of personalized risk assessment could be a game changer in surgery.
That's remarkable. It's like having a predictive tool that helps surgeons anticipate potential challenges before they arise. How about during the surgery itself? What role does machine learning play in the operating room?
Interoperatively, AI-powered systems can act as a real-time assistant to the surgeon. For instance, computer vision can analyze the surgical field, identify critical structures, and provide guidance to the surgeon, ensuring greater precision and minimizing the risk of damage to surrounding tissues.
So it sounds like AI is acting as a highly skilled co-pilot, guiding the surgeon's hand and enhancing their situational awareness. Are there any specific examples of how this technology is being used during surgery?
Imagine a complex laparoscopic procedure where the surgeon is working in a confined space. With limited visibility, AI-powered computer vision could actually enhance the surgeon's view, highlighting critical structures like blood vessels or nerves, ensuring that every movement is made with the utmost precision and safety.
That's incredible. It's like giving the surgeon superhuman vision. And it's not just about visual items, right? AI can also analyze data during the surgery to provide real-time feedback and insights.
Precisely. AI can monitor vital signs, blood loss, and other critical parameters, alerting the surgical team to any potential issues before they escalate. This real-time data analysis allows for quicker interventions, potentially improving patient safety and reducing the risk of complications.
It sounds like AI is acting as a vigilant guardian, constantly monitoring the patient's well-being and providing valuable insights to the surgical team. And AI's role doesn't end when the surgery is over, does it?
No, not at all. AI-powered systems can play a significant role in post-operative care as well. By analyzing data from wearable sensors, medical records, and even social media activity, AI can monitor patient recovery, predict potential complications, and personalize follow-up care.
So AI can help ensure that patients receive the most appropriate care, even after they've left the hospital. Are there any specific examples of how this technology is being used in post-op care?
Imagine a patient recovering from surgery at home. Wearable sensors could monitor their vital signs, activity levels, and pain levels, transmitting this data to an AI system that analyzes it for any signs of potential complications. like infection or blood clots. If the AI detects any concerning patterns, it could alert the healthcare team, allowing for early intervention and potentially preventing serious health issues. This kind of proactive monitoring could significantly improve patient outcomes and reduce the need for hospital readmissions.
It's incredible to see how AI is transforming every stage of the surgical journey, from pre-op planning to post-op care. It seems like the potential benefits are enormous.
They certainly are, and as AI continues to evolve, we can expect even more innovative applications to emerge, pushing the boundaries of what's possible in surgery and revolutionizing the way we deliver healthcare.
It's an exciting time to be witnessing this technological revolution. But as with any groundbreaking technology, there are also important considerations to address. Let's move on to discussing some real-world examples of how AI is being implemented in surgery today. I know the Da Vinci system has been widely adopted, but what other success stories are out there? Well, let's start with the Da Vinci Surgical System, which has become a mainstay in various surgical specialties. Have studies shown a real difference in patient outcomes with this system?
Oh, the Da Vinci system has been extensively studied, and the results are quite compelling. For example, research comparing robotic-assisted laparoscopic prostatectomy using the Da Vinci system to traditional open prostatectomy found that patients who underwent the robotic-assisted procedure experienced shorter hospital stays, less blood loss, and faster recovery times.
So it's not just about the technology itself, but about the tangible benefits it brings to patients. In terms of recovery and overall well-being, are there other robotic systems that have demonstrated similar success?
Yeah, the Maser Robotics Renaissance Guidance System is another great example. It's used in spinal surgeries to guide implant placement. With incredible accuracy, studies have shown a significant reduction in the rate of misplaced screws. Compared to traditional freehand techniques, really highlighting the potential of AI to improve outcomes in even most complex surgical procedures.
Spinal surgery is incredibly delicate, so I can imagine that precision is paramount. Are there any other specific areas where AI-assisted surgery is making a significant impact?
Medtronic's Hugo RAS system. It's designed for minimally invasive surgeries and has shown promising results in colorectal procedures. A pilot study comparing the Hugo RAS system to traditional laparoscopic methods revealed a reduction in operating time and fewer postoperative complications.
So shorter surgeries and fewer complications, those are certainly positive outcomes for patients. It seems like AI is truly delivering on its promise to enhance surgical care.
Yeah, it's an exciting time to be working in this field. We're seeing AI and robotics being integrated into various surgical specialties, leading to improvements in precision, safety, and patient outcomes.
It's incredible to think about how far we've come since that first robot entered the operating room. Back in 1985, we've gone from basic robotic assistants to AI systems that can analyze vast amounts of data, provide real-time guidance, and even predict potential complications. It's a true testament to human ingenuity and our relentless pursuit of better healthcare.
And as AI technology continues to evolve, we can only imagine the possibilities that lie ahead. The future of surgery is bright, with the potential to make procedures even less invasive, more precise, and more personalized to each patient's unique needs.
So what does this all mean for you, the listener who shared their research on AI and surgery? It means that the future of healthcare is being shaped by these incredible advancements, leading to a world where surgery is safer, more effective, and potentially less daunting for patients.
These advancements aren't just theoretical concepts. They have the potential to directly impact your health and well-being, whether it's through shorter recovery times, reduced risk of complications, or more personalized treatment plans. AI in surgery is paving the way for a new era of healthcare.
It's an exciting time to be alive. Witnessing this convergence of technology and medicine, as we wrap up this deep dive into the world of AI and surgery, we're left with a sense of awe at what's been accomplished and a deep sense of anticipation for what the future holds.
It's a future full of promise and possibility, a future where AI empowers surgeons to deliver even better care and helps patients navigate their surgical journeys with greater confidence and peace of mind.
Thank you for joining us on this deep dive into the fascinating world of AI and surgery. Until next time, keep exploring, keep learning, and keep asking those thought-provoking questions. CA8.